a growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
But I really wanted to share yung poem from childhood. So 100 years from now, it will not matter what my bank account was, the sort of house I live in, or the kind of car I drove, but the world may be different because I was important in the life of a child.
Good morning, everyone. We are from Simply Nature, and that is Tito Shen, and I'm Tita Jesslyn.
Jesus loves me.
Jesus loves me.
For our gratitude, Mr. Shan.
Ito na ba ang mga sundalo ng Israelita? Maliit man ako sa iyong paningin, malaki ang aking Diyos. Tutulungan ako ng aking Diyos at lalabanan kita at tatalunin kita.
Nayanig ang paligid sa pagbagsak ni Goliath.
Si Mother Ricky, pasalamatan naman natin si Mother Ricky at palakpakan din natin siya kahit siya ay nasa ibang lugar ngayon. Paano kayo di gagaling, di ba?
Pinupurit, sinasamba kita. And Lord, we believe you for testimony from every child in this place. In Jesus' name we pray. And all God's people say, Amen. Hallelujah.
Nung 2022 po, yung parang inipon ko talagang pera pambili nung Simply Nature, nung vials, na PPARs. Yun po yung iniinom ko.
Cancer lang siya, strong tayo. Kaya patuloy lang po tayong lumaban kasi may Panginoon tayong gumagabay sa atin lagi. Yun lang.
And on behalf of the Simply Nature team, God bless you all. Maraming salamat for blessing us this day. We hope that we have made you all happy. God bless you once again. Here in Simply Nature, we are always with you from start to healing. Thank you, everybody.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months. Cancer-free. Dapat may food supplements kayo. Like Simply Nature na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
Die from cancer, they did die from chemotherapy, they died from pneumonia.
So it's usually infection. I've had this one patient, renal cancer patient, an elderly renal cancer patient, stage 4, who was in and out of the hospital. The reason why he passed was because of an infection he got from the hospital.
Wow.
So,
and like sepsis also is
yes,
another.
he ended up in sepsis.
Okay.
Then he eventually passed. So really, vaccination against these common illnesses, common infectious diseases is really very important.
Hi, welcome to another episode of Simply Healed. And today we have a very interesting topic for cancer patients, which is vaccination for cancer patients. So welcome again, Dr. Jansen.
Hello, Sean. Hello, everyone. Happy to be here again.
Yeah, the last 2 years we were in a pandemic, so vaccination became an important topic. And there were actually questions because should cancer patients get COVID vaccines? But another very interesting question, if you're going for chemotherapy, you know that your immune system is going to be wet.
Yes.
Is it a real strategy? Is it something cancer patients should think about, that while their immune system is strong before the chemotherapy, that they go and vaccinate from things like influenza or COVID, and then so that when they go for chemotherapy, they already have one layer of protection, so that when their immune system is weakened during chemotherapy, they are protected from these diseases?
Yes, because if you undergo chemotherapy, of course your immune system will go down. And the number one concern of oncos, actually all doctors, is infection.
Oh,
because your body won't be able to fight infection because your immune system got whacked.
That's why for chemotherapy, red blood cell count and white blood cell count is always monitored by your oncos.
Yes. Okay, so actually, to be honest, this vaccination among cancer patients is usually a topic that is not much discussed, even among healthcare professionals.
So this is not something every cancer patient thinks about.
Yes, it seems that it's not a priority, or you are so focused on the cancer and you tend to forget about these things, which are also as important, because preventing infection is the number one thing that you should do.
To our audience right now, why this is an interesting topic and worth talking about, I actually know of a few cancer patients that died from pneumonia. They went in for chemotherapy and they caught a cold. It developed into pneumonia, and they didn't die from cancer. They didn't die from chemotherapy. They died from pneumonia.
So it's usually infection. I've had this one patient, renal cancer patient, an elderly renal cancer patient, stage 4, who was in and out of the hospital. The reason why he passed was because of an infection he got from the hospital.
Wow.
So,
and like sepsis also is another.
Yes, he ended up in sepsis.
Okay.
Then he eventually passed. So really, vaccination against these common illnesses, common infectious diseases is really very important. Okay.
So we will go into this topic, some quick guidelines, and you can ask during the Ask Me Anything which of the vaccines that we were talking about interest you and you want to talk more about it. All right. Okay. So Doc, what are the simple vaccinations that a cancer patient should consider before, like for example, going for chemo?
Okay. So first, let's discuss the timing. Now, when would be best for you to take to receive a vaccine? Okay, it should be prior to any treatment that you would be receiving. Prior to initiation of chemotherapy, before you receive radiation therapy, before you have your spleen removed or
Why is
surgery.
The spleen? What's the function of the spleen?
The spleen is sort of like the graveyard of the blood cells.
All right.
Now, usually, why do we undergo splenectomy is because, for example, for blood malignancies like leukemia, it's usually the spleen usually enlarges. You have to remove the spleen so that it doesn't affect the other organs, because it can grow so large. It can obstruct your digestive system and cause a lot of discomfort on the patient. That's why we have to remove it. And usually, if we remove the spleen, together with that is we are more prone to a lot of infections as well. So another one is if you're going to be receiving any immunosuppressant medication like steroids. So this is not only true for cancer patients. This is also true for those who have autoimmune diseases or anyone who's going to receive a long-term steroid therapy. Now, we have two kinds of vaccines. We have the inactivated vaccines and the live vaccines. Now, when can you, or how soon can you get vaccinated? Okay. It should be at least 2 weeks prior to receive or prior to the initiation of the treatments that I have just mentioned. Okay? So that would be for your inactivated vaccines. If it is a live vaccine, then it should be at least 4 weeks prior to the initiation of the treatments.
So sometimes that makes vaccination of live vaccines not possible because in urgent cases they have to go for chemo really soon.
Yes, really soon. Okay.
Alright,
So, what if you are already someone who's receiving chemotherapy, or it's really too late already in the timing? So we have to then wait after you complete your chemotherapy. So how soon? So after you completed your chemotherapy, it's at least 3 months before you can receive vaccines again.
Okay. So, Doc, just to refresh everybody's memory on vaccination, you can't actually catch the vaccine. You can't actually catch the disease from the vaccines, can you?
You cannot for inactivated vaccines.
All right. So, just in case someone is thinking that you have recovered, you just finish your chemo and then you go for a pneumonia shot, and because of that you get pneumonia.
Yeah.
That won't happen.
That won't happen, except for live viruses.
Okay, so don't take the live vaccines. That would be your measles, rubella, herpes. But influenza, pneumonia, all this, hepatitis B, A, HPV, all these are actually inactivated. So they're very safe for you to take, even when your immune system is weak after chemotherapy.
Correct. Okay, so now let's go through each of the vaccines. Okay, so let's focus on the inactivated vaccines first. So here they are. So there are so many, and I will only focus on 4. Okay,
all right.
Because
the key
of time.
ones.
Okay, the key ones. So number 1, very important, is COVID-19. You have to receive a full dose of a COVID-19 vaccine together with boosters. Okay, 2 vaccines
and
to be fully vaccinated.
Very interesting because in Singapore on CNN, I sent you that particular article also. They actually said that the inactivated vaccination for COVID-19, which is your Sinovac,
yes,
creates a broader reaction that allows your immune system to tackle variations of COVID-19 better than the mRNA. Okay, we're not saying that the inactivated vaccine is better than mRNA, but it has a different result.
Yes.
So the ideal is to have both.
The idea is to have both because you'd have a wider range of weapons.
Yeah.
Okay. So anyway, moving on. No? Let's go to influenza. So influenza vaccine is really quite well known. Okay. It's a dose that all companies give away to their employees anyway.
Yes.
So for influenza, 1 dose annually is still the standard, even if you are receiving chemotherapy already. So there's no reason, even if you are receiving chemotherapy, there's no reason for you not to get it. Okay.
So is it advisable, like during flu season, for a cancer patient to actually make sure they're vaccinated if they're going to go for, especially go for chemotherapy?
Yes, even if you are already receiving chemotherapy, okay, it's okay for you to get a flu vaccine, right? So this is the exception among all the inactivated vaccines. So it's the only one that you can receive, even if you're undergoing chemotherapy already. Now let's go to pneumococcal. So,
this is pneumonia?
Yes, this is for pneumococcal vaccine.
Does this mean that if you take this vaccination, you are vaccinated against pneumonia, or it's just that your chances of getting pneumonia is much lower?
You would be able to prevent yourself from getting pneumonia.
Wow.
So yes, this is really very
good
important
because a lot of cancer patients actually die because of edema, which is water in the lungs, and then it develops into pneumonia.
So, but here's the thing, no? Because the pneumococcal vaccine is only specific or a specific strain of bacteria. Now, you would be able to prevent getting infected from that specific bacteria.
But you can still develop pneumonia from other
from the other variants. Now, here's the problem. The one that the pneumococcal vaccine has is the most common cause of pneumonia among cancer patients and for all people for that matter. Now, the exception would be the atypical organisms or the atypical microorganisms. So that would be the rarer ones or the more uncommon ones. Okay?
But I think this is still the best bet.
This is still the best bet because immediately you take away the most common reason for you to get pneumonia.
Yeah, I can't stress this enough because truly a lot we actually have quite a few cancer patients who died because of pneumonia.
Okay, so how should you be receiving the pneumococcal vaccine? So for the pneumococcal vaccine, you have 2. You have the PCV13 and PPSV23. So what's the difference between those 2? It's just that PCV13 makes you immune to 13 variants or 13 species of the bacteria, of the pneumococcal bacteria. For the PPSV23, it's 23 strains.
All right.
Okay, so for PPSV23, it's more complete.
All right.
Okay. Now there are two ways on how you can go about this. First is for you to receive PCV13 first, or Prevnar. Then after 8 weeks, receive the PPSV23. Then that's it. Okay. Or the other way around is for you to receive PPSV23 first, wait a year, then receive another dose of PPSV23.
So if
Then that's
you
it.
okay, and then this can be taken just 2 or 3 weeks before chemotherapy
Yes,
starts.
it should be at least 2 weeks before chemotherapy starts. So you'd have an option here. So it's very important for you to have a date already when you would undergo chemotherapy. Then undergo these vaccinations. Now, if it's really too soon, right? Let's say, for example, you're about to receive your chemotherapy a month from now, then it's impossible for you to receive the second dose if you follow the first path, right? So what you can do is receive PPSV23 first, then wait a year. So the following year, when you're done with your chemotherapy, then you can receive the second PPSV23. But if you still have much time, then it's better for you to get fully vaccinated immediately. So go for PCV13 first, then after 8 weeks, go for PPSV23. Okay. So next would be your HPV virus. This one, we have a whole video about this.
Just go and look at the.
Yes.
This is for cervical.
This one is for cervical cancer. Now, for the human papilloma virus or HPV vaccine, no, all men and women should receive this. Okay?
All right.
Men
It's not
and
just
women.
only for women.
Yes, it's not just for women only. Okay. So why? Go watch the video. Okay. So it is recommended for everyone who are between 9 to 45 years of age. Now, the schedule of the HPV vaccine would depend on which type of HPV vaccine you will receive. So, if you want, just go and ask during the Ask Me Anything segment.
Yes.
Okay, to know more details. Now, next, let's go to the live vaccines. For the live vaccines, I'm going to focus on varicella and herpes zoster because
I was wondering what varicella is. That's chicken pox.
Yes,
All
that's
right.
chickenpox.
Okay, that's chicken pox.
Yeah, so I'll focus on varicella and herpes zoster because MMR, everyone should have received that when you were a kid.
Okay.
But if you want a booster, it's okay. Right? Now, for live vaccines, remember, you should receive this at least 4 weeks prior to the start of you should complete your dosing prior to the initiation of chemotherapy, at least 4 weeks. Okay? So for varicella, this should be given to those without immunity to varicella or chickenpox prior to the start of chemotherapy. So if you have had a history of chickenpox already before,
then you don't
need it anymore. Now for herpes zoster, 2 doses is preferred. Herpes zoster is more of to prevent shingles.
All right.
Okay, because shingles can be so painful. Shingles would be a blister on a specific or area in your body. It can be very painful. It can blister, so it can heal badly as well. So it will leave a scar on your body. And of course, for women are more concerned.
It's important to look good.
Yes,
right?
it's important to look good. So this might be something to consider. Okay. Yeah.
All right. So I think, Doc, this is a very unusual topic, something that a cancer patient seldom thinks about. But again, we brought it up so at least you can ask your uncle about this. And in our experience, in my personal experience, having lost patients because of pneumonia, cancer patients due to pneumonia, I wish we knew about this. So among all these vaccines, I personally am interested to ask patients to think about the pneumonia vaccination before they go for their chemotherapy. So, Doc, any last words before we go into our AMA?
Okay, so if for those of you who are living in the Philippines, especially in the Metro Manila area or the nearby provinces, if you're really interested to get yourself vaccinated, please don't hesitate to message us so we can schedule an appointment so I can get you vaccinated. Okay, so that would be it. We're already seeing so many questions in the comment section,
and a lot of them are not about vaccines.
Yes.
All right.
So yeah, let's get it on.
now watching another episode of Simply Health Webinar brought to you by Simply Nature, your long-time running healthcare awareness webinar here in social media. Our topic for tonight is cancer vaccine. Should you take it before or after chemo? I am very sure that you have learned so much from the two gentlemen who shared our topic discussion for tonight. So without further ado, to answer all our questions at this point, I'd like to call on once again the CEO of Simply Nature and PPAR's expert from Singapore, Mr. Sean Lim, and of course our lifestyle medicine doctor, Dr. Jansen and Calalan. Good evening, Sir Sean. Good evening, Dr. Jansen.
Hi, good evening, everybody. Good evening, Dr. Jansen. So good to see you here in the live AMA.
Hello, Sean. Hello, Sheila. Hello, everyone. Good to see you again.
Yeah, I think, Doc, tonight's topic that you talked about was really an unexpected thing. We don't usually think about vaccination when it comes to cancer, and it's not a common practice at all, too. But it's something that is worth understanding, and it's an option, right? So, yeah, it was a very interesting topic.
Exactly. Thank you, Sir Sean. Thank you, Dr. Jansen. Let us now start with our but first, before we start with the question and answer, I would really like to extend my gratitude to all our VIPs who attended our VIP meetup last night. Hello, our dear VIPs. Thank you for joining us.
Yeah, thank you, everyone. I know it's Christmas season, and usually we have so many parties to go to, so it was really nice to have your support. And thank you. That was the last VIP event for the year. I hope you enjoyed the duck race. And I think everyone, I heard my wife tell me Chef's B Paella looks really good. So I hope everyone enjoyed. We have very exciting things lined up for next year. So we're going to do our best to continue to serve you better.
Thank you, Sir Sean. Right, so for the first question for tonight, coming from Miss Shirley Paner. Doc, if you have cervical cancer, can you still take the HPV vaccine?
Very good question. If you have cervical cancer already, yes, you can. Yes, you can still receive the HPV vaccine. However, since you already have what the HPV vaccine is meant to prevent in the first place, so now the benefit would negate the benefit of the HPV vaccine in the first place. Okay?
So there's no point in...
Yeah, there's no point in receiving it anymore, although you still can.
That means it won't do you any harm, but there's no reason to take it.
Yes.
All right. So that's, I think that clears it up for the person who asked this.
That's good. Thank you, Sir Sean. Thank you, Dr. Jansen. For this next question, I think the person asked this is a new viewer of ours, coming from Mr. Junjun Garan. How would we know a person has a cancer?
Well, how do you know a person get cancer? So he's asking, without going for a diagnostic, is there any symptoms outwardly that would make you suspect you have cancer?
Okay, this is purely on history and physical exam. Okay, without undergoing any tests. Yes, you can. Okay, you have to go to a doctor. That's the short answer. But there are a lot of things that the doctor considers, especially when it comes to the history. Now, in medicine, it's like this, no? With history alone, you would be able to get more or less 80% of the diagnosis. 80% with history alone. Physical exam would give you another 10%. Okay, so about 90% you will already have an inkling of what the diagnosis is. So the remaining 10% would now come from the laboratories. Okay, so that's how a doctor thinks. Okay, so if a doctor is considering a cancer diagnosis, so from the patient's history itself, you would hear that the patient has a mass, a growing mass, or probably, if for females, probably a discharge, foul-smelling discharge coming from the vagina. Probably it's bloody as well. Or for both male and female, it can be coming from bloody stool. Okay. For male and female, no, When you hear something like incessant coughing, coughing for a very long period of time, coughing for at least 6 months, then when the patient coughs, there's blood coming out from his cough, no? So that would give you an idea, okay, probably this patient has cancer. Now the doctor will do the physical exam. Okay, so depending on how the patient described the illness. So let's say, for example, you have a growing mass on the breast. Okay, so the doctor will now do a physical exam on the breast. Okay, so how do you do the physical exam? First, you look. Okay, inspect the breast. Okay, how is the mass physically visible without you touching? Okay, if it is, then most likely, yeah, you'll have an inkling on what size it is, its shape. If it is not, then probably you have to palpate the breast. Okay, then try to feel the mass where it is. Now, once you feel the breast, what are the characteristics of the mass? Is it hard? Is it regular in shape? Is it irregular? Are there any skin changes? So that's the answer to that comes from just looking at the breast. No, are there any discharge, nipple discharge, wounds? So these things will add up to your suspicion that a patient might have cancer. Okay. Now, in order to confirm if the patient has cancer, you will need to do laboratory tests, imaging tests already, depending on your suspicions. Okay? Or depending on the different diagnoses that you are considering. Okay? So, laboratory tests will now be used to confirm the diagnosis or to rule out other diagnoses. Okay? So, that's how a doctor thinks. So, just by doing history and physical exam, a doctor will be able to know if the patient most likely have cancer or not. Okay.
All right. So, I before I chime in, I just want to greet Lily from Malaysia, my neighboring country. I'm from Singapore, so very nice. I'd like to also acknowledge Nathan. After he asked a question about one of his loved ones. He's been regular here on our program. So Nathan, I hope you're continuing to understand cancer better and better. I'd like to greet those from Davao, from different places of the world. All right. So Doc Jansen gave a answer from a doctor's perspective. I would like to share with you as a patient. Okay. So every time that I think this year I had some urinary tract infection that I suspected. I asked Doc Jansen straight away. Number one is I don't sit at home and wonder whether I have cancer or not. I don't sit at home scaring myself. Okay, first thing I do is I straight asked Doc Jansen. He looked at it and then I said, okay, what test can I do so that I can sleep at night? So he said, okay. He started to tick, 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 tick. I said, okay, give me everything. All the tests that is necessary. No need to save money, all right? So, because for me, I really wanted to know. So, he gave me all the diagnostics. I think the whole thing cost me about maybe 3,000 pesos. Something around that line. But, I did so many tests and everything came back negative, so I was very, very at peace, right? It's not like I saved 300 pesos, then I wonder, maybe I should have done that last test. Maybe it would have been positive. So I just want to share that, don't. This is your health, especially if you're worried about cancer. Anytime you are truly worried, just worrying about a disease in itself can make you sick. Not to say it will create cancer, but it will just weaken your body and you might get a flu or something like that. So settle it by going for a simple consult and check if you need to do some diagnostics. Again, I want to remind everybody, we always think that it's so expensive, to go and check things out. I want to let you know, to sit at home and worry, what is that lump? It's going to cost you a lot more than that few hundred peso consultation. And nowadays it's so easy. If you're comfortable, for example, you would like to consult with Dr. Jansen, you don't even have to travel to Metro Manila. You can just make sure you have a good internet line so that you can hear clearly, and at the convenience of your own home. at a timing which fits. You know, you can even do it in lunchtime while you work from home or something. You can settle your mind and be at peace. Okay, so I think what is important about what Dr. Jansen said is that a doctor can suspect or basically let you have peace or confirm that there is something to be worried about with simply just your medical history. You know, so you don't have to think that, I need to come all the way down to Metro Manila in order to know whether I should be worried or not, right? So a simple, even a teleconsult, the doctor can tell you, for sure, you know, you are no need to be worried. Or he can tell you, there's something there you need to do. Don't have to worry so much yet, but, you know, let's do this few tests and then we'll know for sure. So you see, don't stay at home and worry. Instead, just find out as quickly as possible. And there's one more reason why you should. Dr. Jansen always shares, and that's why our patients here love it. Always shares. If you catch cancer early, it's almost 100% cure rate or remission rate for many types of cancer, from breast to colon cancer to prostate cancer. If you catch it early, the prognosis is very, very good. You have like 90% chance that you will recover. So there's no reason not to find out.
Okay, thank you, Sir Sean. I think you have given our viewers something to really think hard about tonight, and at the same time, very encouraging as well. Thank you. That's it. Another question. This question was sent to us last night. I'm sure that some of our VIPs are still watching us because we have some questions that weren't being able to answer yesterday. Okay. So one question is PPARs effective on managing hypothyroidism?
Oh, yes.
Wow, you have experience with this.
Yes.
Wow.
Okay, for hypothyroidism, patients tend to become obese and they tend to develop metabolic syndrome. Now, PPARs is very good in managing metabolic syndrome. Okay, so yes, PPARs can definitely help patients who have hypothyroidism. But the main the outright answer to hypothyroidism is to medicate with thyroid hormones, okay, or to really look at the underlying reason why you are hypothyroid in the first place, okay? Because hypothyroidism can be because of autoimmune disease. Being hypothyroid, probably already have had your thyroid removed, so that's why you're hypothyroid. Okay, so as simple as those things, we have to consider, and then we have to make our prescription or recommendations based on your history or on your profile. Okay, but yeah,
wow,
PPAR therapy is really good
effective
for hypothyroidism.
Yeah, I'm very surprised because, you know, Dr. Jansen always deals with cancer patients. I was about to say, you know, yes, I didn't know he had hypothyroidism patients as well. So that's very good.
Thank you, Sir Sean. Thank you, Dr. Jansen. Right. Sir Sean, you mentioned a while ago that you knew some patients who had complications with pneumonia. So the question now coming from Ms. Shirley is that she'll be having 2 to 3 weeks from now, she'll be having her first section of chemo. Where should she get the vaccine for pneumonia?
Okay, your pneumonia vaccine, you can get that from your primary care doctor. You can get that from your nearby, if you're living near outpatient clinics, okay, you can get a pneumonia vaccine from there. Or if you are in Metro Manila, I can give you the vaccine itself. Okay, I can administer it to you. So if you're in Manila, then you can visit my clinic at Centuria Medical Makati. That's Centuria Medical Makati, room 1439. But please set an appointment first, so I know that you're coming. Okay, so and also I know I ordered the vaccine. Okay, so yeah, I can give it to you, or if you're not in Metro Manila, you're in a very far away place, any outpatient clinics that's where it's available, or they offer vaccinating services, that would be available there. Okay.
You know, that's why I was very surprised when we did this program, this particular episode with Dr. Jansen, because personally I've had cancer patients who were doing well then caught pneumonia, and then they died not from the cancer, but they died from pneumonia. Yes. So it was like very sayang. It's so funny. You were looking out for the truck, then you got hit by the bicycle and died. You know, it's like being blindsided. Because she was already, her breast cancer tumor reduced in size by more than half. So we were all looking forward to a great success. Then pneumonia hit her. So that was very unfortunate. So I was very surprised when I was doing this interview with Dr. Jansen that you could actually just vaccinate from common pneumonia and avoid this unfortunate incident. I think this is very important for people who are living in places where you could catch pneumonia. Maybe right. So so that's just thank you. You know, good question.
Thanks for that question. Right, another question coming from Ms. Guz Amber.
Yeah, it's good.
Good evening. Good evening. My mom and aunt died of ovarian cancer but metastasized to lungs. Now I have breast cancer but already 1 year and 6 months on remission. Question: would you recommend that I undergo BRAC analysis or BRAC analysis?
Okay, so that's your BRCA. Okay, that's the gene for the breast cancer. I suggest for you, yes. If you haven't underwent mastectomy yet, if you have just one breast removed, it would be better for you to undergo a BRCA test. So right now you're already on remission, so preventing cancer or preventing recurrence is the priority. So undergoing BRCA analysis would make sense. Okay,
that's good. You know, I'm reminded about the program that we did on cancer remission and recurrence rates. Correct me if I'm wrong, Dr. Jansen. The recurrence rate for breast cancer can be as high as 30%, if I remember correctly.
Yes.
So, and for all viewers tonight, you know, I wanted to highlight something that is for you to be mindful about. So in Singapore, when you get insurance for cancer, you are covered 2 bouts of cancer. So not just 1 time, but 2 times. That means that statistically, that even the insurance companies acknowledge they had to give you enough money, not for 1 cancer, but for 2 times. So it just tells us that don't let your guard down when you are in remission, right? You got to aim for the first benchmark is that every year that you're clear. The second benchmark is to reach the 5-year mark, and after that is the 10-year mark, right? So so continue to, and I hope that our program like this helps you, give you more options on what you can do to stay cancer free.
Thank you, Sir Sean. Thank you, Dr. Jansen. Right, another question coming from Ms. Joy Panugali. Is it okay to take osimertinib while taking PPAR's powder and tablet?
Yes, those two, the drug osimertinib and PPAR agonists work well together. Yeah.
So it's not just that there's no contraindication, there's actually positive interaction.
Yes, they have synergistic effect. Yeah, even.
Excellent. Thank you, Sir Sean. Thank you, Dr. Jansen. Okay, another question. This one is very interesting. Coming from Ms. Barachi. Is extra virgin coconut oil considered good plant-based food?
Good plant-based food? No. Well, depends on to what food you compare it to. Okay, that would be, I think, the better question. So, extra virgin coconut oil, if you compare that to, for example, butter, lard, animal fat, then extra virgin coconut oil would definitely be better. Okay, it would definitely be beneficial. However, if you compare extra virgin coconut oil to olive oil, then olive oil will be superior. Just because extra virgin coconut oil is very high in saturated fats. Okay, how high it is, I want to invite you on our next webinar next week where we talk about it. Okay?
Yes, next week, Dr. Jansen, we just did the taping earlier today. He's gonna give key indicators on how to choose food so that you can manage, so that you will know whether a food is high fiber, high or low sodium, high or low saturated fats. Okay, he's going to give you formulas and tips to know exactly whether a food is like that or not. And this is important because that's our Christmas special.
Yes.
Because we know all of you, including myself, we will want to be eating this Christmas. So at least pick the foods that are, I guess, better. All right, pick the better choices so that you can enjoy yourself.
Okay, so yep, that would be my answer. So if you again, let's go back. If you compare coconut oil to olive oil, now coconut oil is very high in saturated fats. So it is established in the medical literature, it is established in science that saturated fats, if you consume them, that will raise your LDL cholesterol, total cholesterol. So that is the cholesterol that stimulates the blocking of the arteries. Okay, so if your arteries become blocked, if it happens in your heart, that will cause heart attack. If it happens in your brain, that will lead to stroke. Okay. For diabetes, saturated fats blunts the effect of insulin. So you will develop insulin resistance. By insulin resistance, it means that the capacity of your body to lower your blood sugar will be blunted. It will decrease. So as a result, you will have high blood sugar. If you have high blood sugar, you will be diagnosed with diabetes. Correct. Okay. Another thing, with saturated fats, if you consume them too much, that can also stimulate the metastasis of cancer, of solid tumors to be specific. Okay? So, be careful of saturated fats. Now, compare that to olive oil. Olive oil is very low in saturated fats. It is actually very high in polyunsaturated fatty acids. So, the polyunsaturated fatty acids are the beneficial fatty acids for our body, for humans. Okay, so it's actually better if you consume olive oil instead of coconut oil. However, do not consume too much olive oil because it is still an ultra-processed food. So rather than consuming olive oil, eat the olives. Okay? So yeah, that's my answer.
I just wanted to add a comment to Dr. Jansen's answer because many of us have tried virgin coconut oil and we may have seen some health benefits. Let's say you take it for 3 days a week and you notice some improvements in your health. Now, we're not saying that virgin coconut oil does not have health benefits. We are saying that if you take 2 tablespoons of virgin coconut oil every day for more than a month, you're going to create other risks. So yes, if you just take for 1 week, you may have seen some benefits to your health, but as you take more and more of it or consistently large amounts of it, it's going to create other problems. And for cancer patients, as Dr. Jansen says, it will actually promote tumor growth. So if you took it for a week, you might feel more energetic or something and you think, oh, this is good for me. Yes, it is good for you, it was good for you, but if you continue taking it, the goodness will be overwhelmed by the other effects, which is the buildup of saturated fats in your body, and then it will become negative. All right, so I hope that helps you understand what we're talking about, because some of you are taking VCO and says, hey, I feel good, right? Yeah, you feel good, but don't keep doing it because there will reach a point you won't feel good anymore. Okay, so that's, and we are explaining why, right? Because as cancer patients, fat buildup is going to affect your insulin sensitivity, and that's going to affect, because insulin, like hormones, right? It will actually promote tumor growth. So once you reach that level, it creates another complication. Okay. So, and another important thing is, if you're looking for something that will be healthy for you, there are better options. So it's not, virgin coconut oil is not the only way to get those benefits. There are other things that you can take to give you benefits as well without the downside.
Thank you, Dr. Jansen. Thank you, Sir Sean.
Sheila, can we go to Marlene's question, because it's very related to the one that Doc just answered about BRAC.
Oh yeah, she wants you to explain it further because her uncle didn't mention that to her.
Yeah.
Could you explain further?
Yeah. Okay, because I don't know your history, So, but okay, just to give you an idea what BRCA analysis is. Okay. For breast cancer, we know that breast cancer can be hereditary or it can be acquired. So by acquired, meaning that the reason why a person develops breast cancer is because of her lifestyle. His or her lifestyle, okay? Because males can get breast cancer as well. Okay, so the BRCA is a gene, okay, inside our body. When it mutates, it significantly increases the risk of that person to develop breast cancer. Now, the BRCA gene can be passed on to the next generation. Okay, so if a person has a BRCA mutation, then that person has a very high chance of developing breast cancer later on. Okay, now for your case, since we know that you have a family history of ovarian cancer, you yourself developed breast cancer. So with these information alone, you have a very high propensity of developing cancer because of your family history, because it's in your genes. Okay? Now, the next question is, have you had surgery already? Since you are on remission, most likely you would have had surgery already. The next question is, how many breasts were removed? Is it just one or is it both? Now, if it's just one, most likely it is just one. So you have your other breast is still there. Now, the question is, okay, now the breast that is remaining is still normal, of course, no? Nothing abnormal in it. However, another question would be, in the future, would my other breast develop a tumor later on? So that's a question that that will keep on bugging you every night. So a BRCA test would be prudent for me. That's my opinion. It would be okay for you to undergo a BRCA test. Why? Because number one, if you know that you have if you have that mutation, then you can now think of, okay, I have my one breast is already left, no? I still have one breast. Would it be more prudent to have it removed altogether, so you don't have to undergo everything that you have underwent up until now, right, for your cancer treatment. Another thing is, another very important question would be, if you have a daughter, okay, if you have a daughter and you have the BRCA mutation, then you can advise your daughter much better, especially on how she lives her lifestyle. Okay, so those are the two questions that the BRCA test would be able to answer. Okay.
So the BRCA test will allow our viewer to decide whether she wants to take preemptive measures on the remaining breast, right? And I think that's what Angelina Jolie did, right? So I assume she was BRCA positive.
BRCA, yeah.
She decided to have both breasts removed and then a reconstructive surgery, because and she's alive today and never developed cancer. So so that's a preemptive move. Yeah. And I think when you combine that to recurrence rates, it's worth taking a look.
Yes.
If you want more concrete answer, is BRCA analysis expensive, Doc?
That I do not know. I do not know. But I guess it would probably range in the thousands.
Okay. But it's not in the hundreds of thousands or tens of thousands?
No. Probably, well, I'm sure it's not in the hundreds of thousands, but probably around thousands, probably 10,000, around that range.
Okay, so if it's that range, it's definitely affordable. It just means one less blowout, right? And I think then you will have a clearer picture of your family's prognosis towards getting a recurrence, and also other people in your family, especially blood relatives, getting cancer. And then you can make changes to your lifestyles to prevent that.
How about, Doc, I'm just very curious, how is it done? Is it like mammogram?
BRCA mutation.
No, how is it? What's the BRCA analysis? Is it a blood test or?
Let me confirm.
Let me
confirm with my sources.
But whilst that, I think I saw a question by Avio at something about someone pooping, someone pooping fresh blood, does he need to worry?
About Edna Avio.
All right, so I just wanted to answer
Yes, may I ask if someone pooped with fresh blood?
Yeah.
Go ahead, sir. Okay.
Yeah, again, if you're worried about cancer, as Dr. Jansen has mentioned before, cancer is not just a one-time pooping of blood. It's repeated with other symptoms. Now, of course, an endoscopy, a colonoscopy is both expensive and uncomfortable. All right. So one thing that you could do is just have a brief consult with a doctor of your own choice, or if you are more comfortable, go and have a consult with Dr. Jansen. So that is very painless, and that could give you a clarity of whether you need to go for a colonoscopy or endoscopy. So I think that's one solution instead of immediately going for colonoscopy or endoscopy.
Thank you, Sir Sean.
And that's what I personally do also. Before I go for all my diagnostic tests, I call up my very, very good and handsome friend, Dr. Jansen, right, and tell him my symptoms, and then I tell him, hey, don't help me save money. If you have any suspicion, just tell me. I'll do all the tests. And I even remember I was not feeling well, and normally I just bear with it because I like to give my own immune system a workout. So, but I was having a stubborn cough or something, and I called Dr. Jansen up, right? I said, Doc, should I take antibiotics? And to my surprise, he said no. And after that, I said, why? You just want me to endure and give my immune system a workout, right? He said, yeah, because whatever you're suffering is not so serious, might as well let your immune system exercise. So I was surprised. I thought, he will be trigger happy and just prescribe to me antibiotics, but instead he said, just suffer through it, it's okay. It strengthens your immune system. So that's why I'm just saying, the beauty of teleconsult nowadays is that you don't have to queue up, you don't have to drive 2 hours, queue up 2 hours in the hospital, spend half a day, take leave from home, from work just to ask a question. You can simply arrange it and put your mind at ease. Yeah, Doc.
Yeah, I'll answer your question, Sheila.
Doc, go ahead.
The BRCA test, okay, it can be done in a number of ways. So number one is through blood draw. Another one is through saliva. Another one is they will swab the inner lining.
Basically, it's a DNA test.
DNA test.
All right, it's a DNA test.
It's not painful.
That's the procedure on how they get the sample for the BRCA testing. Okay.
Oh, I see Marlene asked a question. I think if I were to guess, the answer is yes, right?
Yeah. Now, okay, you have had mastectomy. Okay, now 2 daughters should have analysis. Here's the thing, for BRCA test, if you test positive, so as a mother, if you as their mom, if you test positive for BRCA, then your 2 daughters is most likely will be positive as well. But on the off chance that they are negative, there's that chance as well. Okay, so for this, if you really want to be sure, 100% sure, okay, then just go for the testing. Have your 2 daughters undergo the tests as well. But if you are, financially more constrained and you can only afford to have one test, then
test one. The other one will be probably the same.
However, here's the thing, depending on the age of your 2 daughters, here are a number of points that they can do if you test positive. Okay, if you test positive, then you don't know if your 2 daughters are positive or not. So we know that they are positive. They are most likely positive. Okay, so depending on their age, if they are less than 35 years old, then just advise them to live a healthier lifestyle. Okay, so that would be a very strict lifestyle. Okay, because you are prone to develop breast cancer already. So it is in your best interest to turn that or switch that gene off. Okay, so how should you live your lifestyle? So that would be a strict plant-based diet. That would be regular exercise. You have to sleep well. you have to manage. You really have to manage your stress. Okay. Now, if your two daughters are not amenable, okay, so if a daughter is not amenable to this,
it means she cannot give up the eating lots and lots of meat and things like that.
Now, I understand that habits can change, no? But if she is not amenable to this, also, if she is of age, how old would this be? At least 35 years old. Then I think it would be more prudent to consider prophylactic mastectomy. Okay, to prevent breast cancer from occurring in the first place. Now, whether or not they undergo prophylactic mastectomy or preemptive removal of the breast, no, that would be entirely up to them. Okay, because that would violate a lot of women's
personal identity.
So
right.
it's a very sensitive discussion that you guys have to talk out. Okay,
but
discuss.
Having that discussion would probably give enough motivation for them to change their lifestyle. Because given the choice of having a prophylactic mastectomy or changing your lifestyle, that will give a lot of impetus to say, hey, you know what, let's try the lifestyle first.
Yeah, but removing the breast, here's another thing that you have to consider. Do your daughters plan to get pregnant later on? And if they do, is it okay for them not to breastfeed their baby? Okay, because the best milk for babies is the mother's milk, right? So these are things that you have to consider, because there are moms that would not want their babies, their kids to be fed other milks, right? They want to feed their baby only the milk that comes from their body. Okay, so you really have to talk things out. Okay, but those are some of the considerations that you have to think about. Okay.
But for Marlene, who asked this question, I think what is really real and that we have discussed many times is that cancer is hereditary, right? So, and it's not sons that you have, it's daughters that you have. So things are not stacked for them. However, the good news is, right, Dr. Jansen, if your two daughters manage to avoid breast cancer throughout their lives, there's a chance that they remove the cancer gene when they procreate. So that means you could be the first one to introduce the cancer genes to your family. You could also be the one to break the chain, and that your future generations, your great-granddaughter, your granddaughter, they don't carry these genes anymore because you never manifested breast cancer in your life. Right, so on both sides, I think that gives us a lot of reason to take action. Like I said, so Doc, I think maybe we can do something next year in 2023 for this particular topic. We can probably give something for Marlene's daughters to see what it means to live a life that is fully enjoyable, fully fun, eating lots of delicious food, and still be anti-cancer life for a person who has DNA predisposed to cancer. So,
and it's very fortunate that we have Chef B already.
Yeah, we have Chef B. So if you were a VIP guest, you would have seen very delicious paella that is totally anti-cancer paella. So that is so good, right? So I think more of these things so that persons like Marlene and her daughters can actually, those who know they're at risk, can still live a very fun, very fulfilling life and just make some changes.
Come to think of it, our VIPs and patients are truly blessed to have Dr. Jansen and Chef B around.
Yeah.
Thank you. All right, so another question coming from Mr. Lipaner. I have cervical cancer that metastasized to pelvic. Which PPARs would be better? Is it the soft gel or the powder?
Depending again on the other treatment protocols that you're undergoing, and if you are considering undergoing those protocols in the first place. Now, if for cervical cancer, the mainstay treatment, okay, that would be effective is concurrent chemo radiation therapy. So that means you give chemo and radiation therapy at the same time. Okay, so if you are undergoing such a thing, then the better PPAR protocol would be, the best would be liquid, PPAR's liquid. Okay? Because PPAR liquid would be able to protect your bone marrow so that your blood counts don't go down so much. Aside from PPAR liquid, you can also take powder. Okay? Actually, even soft gel. Okay, some patients actually do have soft gel when undergoing chemo. Now, if you are not considering undergoing chemotherapy and radiation therapy, then liquid would be the best. That would be the way to go. Okay.
To make some sense about what Dr. Jansen, to understand his protocol, you have to understand, if you're not going to use other ways to kill the cancer tumor, then you got to use the strongest natural way, right? So that's why he would prescribe the strongest solution that is available, which is the liquid PPARs. Okay. Now, if you're going to go for other ways to kill the cancer cells, then you can, it's not your only attack, right? So you already have something else that's attacking the cancer tumor. So then you can opt to choose to use not the most powerful natural as well. So this would actually be dependent. I'm reluctant to say this, but this is reality. When it comes to fighting cancer, how much financial power you have allows you to have more options. So again, in treating cancer, especially with the natural protocols, you can do overkill. That means you can use the most powerful even when it's not necessary, because it will just boost your chance of success. Okay, but however, we have to acknowledge that cancer is a long-term fight, so having a financial strategy is also important. You don't want to run out of money halfway through your cancer treatment. So, be truthful when you have an appointment with your doctors. For example, if you're going to have a consult with Dr. Jansen, don't be shy. We all have different financial commitments. Even some of us have to support other family members. So we have financial constraints. Just let him know what your financial constraints are so that we come up with the best strategy with the budget you have. Now, of course, if money is not an issue or you have a lot of support from your family members, then deciding to go for the best that money can afford is a very valid and, of course, the safest strategy, to use the very best in everything that you do. But like again, I say, real life has constraints. Don't be shy about it. Let us know. Many cancer patients who are financially in difficulty actually start with the soft gel. Dr. Jimmy, our surgical oncologist that work with us, many of his patients are on soft gel. When do they move to the liquid? When they have complications. So that means they start with the soft gel. If everything is going well with the chemotherapy and the soft gel, oh, that's great, right? Because many of his patients come from the lower income bracket. But however, all the wealthy patients don't start at soft gel. They just go straight for the very best that they have. So they all work, all right? It's just it's all about chance or probability. So we can start with the what is manageable and hold back your finances as part of a discarte, right? If everything goes well, then okay, we don't have to shoot this bullet, right? Because you only have one bullet to shoot, right? You only have so much funds, so you save it so that it can be flexible. It can be used for surgery, it can be used for liquid, it can be used for many things. And so we start with the soft gel first. But if funds is not an issue, you can do the best for everything.
Thank you, Sir Sean. Just to echo out what Doc Jansen and Sir Sean said, when it comes to the PPARS protocol, it's always, for cancer, the liquid is always best option.
Yes, the liquid is always the best.
Thank you, sir. Thank you. Now, all right, so the next question, it's quite interesting because the question is, if I have swollen lymph node in my armpit, can I still get vaccine shot in that arm?
Swollen lymph node, yes. Yeah, definitely yes.
Why, Doc? Why do you say yes?
Okay, the question might be coming from a breast cancer patient, because if you underwent mastectomy already on that, let's say for example on the right arm, you cannot put an IV line on that same side, because your arm will swell up. Okay, that's lymphedema. Now, if you are not a cancer patient, no surgery at all, you just have a swollen lymph node on that area, then if you administer a vaccine, since the vaccine is only 0.5 ml, then that won't cause any harm, or it won't swell up your arm. Okay, that's the main reason why we tend to shy away from giving or inserting an IV line on the same side as the area of
swollen lymph
mastectomy.
node. No.
Okay, so yeah, but of course, if you can draw blood from there, it's just that you cannot insert an IV line on that same side, because if you insert an IV line, the IV fluids will go into your arm. Since you have no lymph nodes already on that part, your arm will swell up. Okay, but if you just have a swollen lymph node, then the lymphatic drainage is still intact. Okay, so you can insert an IV line, you can draw blood, you can inject a vaccine on that same side of the arm. Okay.
Wow, that's a good answer. I assume that the listener has a compelling reason to want to take the vaccine, or else she would just say, let's wait for the lymph node to subside. So maybe she needs to travel or something. So I think Dr. Jansen's giving you assurance, yeah, you can go ahead with your vaccination.
Thank you, sir. Thank you, Dr. Jansen. Another question from Shirley. So when it comes to I think she's talking about PPAR protocol, which when is it best to start off? Before or when the treatment has already started?
Oh, definitely before, right? Because before you strengthen your body, because if you go for any oncological protocols, it's going to hit both the cancer and your healthy body as well. So the stronger you are going into these treatments, the better it is, right? So you will notice that many people who do well in chemotherapy or surgery, let's say for example surgery, they do well because before the surgery they were strong. So they go through the surgery with less chance of any complication happening. All right. So, but exactly what to take, again, financially, right? So if based on your financial, the best scenario is very simple. If you have unlimited money, just start taking the liquid, right? If you don't have unlimited money, then you strategize a proper protocol. So you can start with the tablets first to strengthen yourself, and maybe even the soft gel, all right? And as you go into, because both the soft gel and the tablets are very financially manageable, right? It's just a few thousand pesos. That will help bring down your metabolic rate, metabolic syndromes, makes whatever treatment that you're going for going to be great. Then you hold your financial bullets, right? So that as you go for the treatments, if anything doesn't feel right, you start to feel weak, okay, let's go to the next level and see how that goes. The reason why for people who are financially strapped, they might have to strategize with finances. It's an important part of planning your fight against cancer, is because cancer can have surprising developments. Suddenly it grew very fast, and then you have to take an extra 2 CT scan, and that's going to cost money. So you just want to make sure that you don't drain your bank totally to zero immediately. You have a strategy. You take the best combination protocol and your finances. So that's where I really appreciate Dr. Jansen and his team, because they don't just I think Dr. Jansen, being a great doctor, he will prescribe you the very best. And then don't be shy, don't just ghost call when his team follow up, right? Sometimes I realize in Philippines, many people are shy just because they don't want to tell Doc, I can't follow your protocol. So they will just avoid the follow-up calls from his nurse, thinking that they are very shy, that they don't want Dr. Jansen to know, oh no, I cannot afford the protocol. No. All right, there are alternatives. This is not a flu we are talking about. This is cancer. Just be honest, all right? Just be honest, and then the team is very compassionate and will work with you to get the best option, all right? So that you don't just do nothing, okay?
I'm surprised you know the term ghosting. Thank you, Sir John. Thank you, Dr. John. Would you like to add on that, or shall we continue with the next question?
Yeah, continue.
Okay. Alright, so for the next question, this one's interesting. If I already had COVID before, do I still need to receive COVID booster?
how many booster shots have you
had?
received?
Yeah.
How many COVID vaccines have you had before? So that's the question that we need to answer first before I say yes or no to your question. Okay. So well, for COVID vaccines, what the data that we have right now, especially with the first generation, first generation vaccines, it's first generation COVID vaccines. It's that 3 booster shots. Not 3 booster shots.
That means one shot,
booster shot.
one
So
booster
three vaccines, 3 vaccines is enough already to confer immunity, okay, to fight severe COVID. Now, for those of you who have very high exposure to COVID, I mean, you are working in industry, when you talk to people, you are working.
For example, you work in a hospital.
Yeah, hospital, call center. Call center, because the floor, a lot of agents are beside each other, what else? Food and beverage industry as well.
You're meeting strangers all the time.
If you are working in construction, okay, so if you are in those industries, then it would be prudent to get four COVID vaccines in total. So, but that's it, Anything beyond 4 would not make sense anymore, because the amount of antibodies that your body will generate will be so small already.
Doc, personally, since you're a frontline, and I know you literally go down to test COVID patients and you really consult with COVID patients, how many shots have you taken?
I have 4. So 2, my primary shots were AstraZeneca. So AstraZeneca, then the next one was Moderna. 2 Moderna vaccines.
Okay, so that's a good question. Thank you for person who asked that one. Okay, so the next question we have here, okay. A while ago, the question was if the person had already cervical cancer, is HPV vaccine okay to still be taken? This time, what if the patient has ovarian cancer? Should she still take the HPV vaccine?
Yes, because HPV vaccine will prevent cervical cancer and not ovarian. Okay, so in this case, then yes, by all means, you can receive the HPV vaccine. Okay?
Yeah, and I think very strong reason to, if you have already undergone a fight with ovarian cancer, you know how terrible or challenging it can be. So cervical cancer via the virus is totally preventable. So go for it.
Thank you. Another question sent to us privately is good. If I receive blood transfusion, will I also get the effect of their vaccine from the person who got vaccinated?
Yes,
really?
Yes.
Antibodies you will also be able to get. However, for blood transfusions, it depends on what kind of blood product they give to you.
If it's just plasma or is it full blood? Yeah.
If it's whole blood,
yes.
then yes, you can get. If it's packed RBC, frozen plasma, you won't. Okay, because those blood products have been processed already. But if it's whole blood, then definitely yes.
That's why they do blood transfusions from adults to kids, because kids have not developed immunity. So sometimes when they are under attack by some virus or bacteria, they actually blood transfusion from their parents, so to transfer immediately the antibodies straight from the parents, right, Doc?
Yep.
Wow.
Thank you, Doc. Thank you, sir. All right, another question comes.
Very interesting questions tonight, huh?
True.
Yeah. It's fun. I mean, we are all learning together. That's great.
Next question. What is the best pneumonia vaccine for asthma patients?
Best pneumonia vaccine for asthma patients is we have Prevnar and pneumococcal EPSV23. Okay, Pneumovax. Those are the most widely used vaccines. So for asthma, you can receive either Prevnar or Pneumovax.
Okay, I'm gonna go out. Sorry, Sheila, go ahead.
It's okay. I know that the pneumococcal is given to kids, right, with the babies and toddlers. Can that protect them from the complications of other illnesses when they get pneumonia?
pneumonia only, but again, for kids, no, because they're a totally different demographic. So for kids, for children, the most common reason why they get pneumonia in the first place is because of viruses. Okay, viral reason. So if you give pneumococcal vaccine to kids, yes, you can prevent a substantial amount of pneumonia. However, you cannot prevent pneumonia from happening to them 100% because pneumococcal vaccine prevents bacterial pneumonia.
But not viral.
But not viral pneumonia. However, it would still be beneficial to receive a pneumococcal vaccine even if you get a viral pneumonia because you can help your body better in fighting or recovering from the viral pneumonia because a viral pneumonia can lead to bacterial pneumonia as well. It can happen at the same time. So you have a virus that caused the pneumonia, and then your immune system is so weak that it leads to bacterial pneumonia. Okay, so these things can happen when we're talking about kids. However, for adults, it's different. Although for adults, the most common cause of pneumonia is still viral. However, adults can fight viral pneumonia much better compared to bacterial pneumonia. If adults develop bacterial pneumonia, definitely we will need antibiotics. Okay, and for adults, if we receive pneumococcal vaccine, then we can prevent the bacterial pneumonia. Although again, not 100% because the pneumococcal vaccine gives you immunity to a specific number of bacteria only. So bacteria outside from that list range. Outside from that range, you can still develop pneumonia from those other bacteria. Okay, but the pneumococcal vaccine, the bacteria that they put there, the strains of the bacteria that they put there are the most common causes of pneumonia. Okay, so statistically speaking, you would be able to prevent at least 95% of the pneumonia that will happen in your lifetime.
Thank you, Doc. Thank you, Sir Sean. Yes, sir, you were saying something?
I wanted to add something to it because this viewer actually linked her question of pneumonia to asthma. I want to share right now that many forms of asthma can be treated and cured through Chinese acupuncture. So I know, just in case, because in the Western conventional medicine, you can't cure asthma. So the person will be on inhaler, have to watch the allergens that they are sensitive to. But I can tell you for certain, you can actually treat asthma successfully through acupuncture. So this might be something that is unknown to many Filipinos because many Filipinos culturally is more aligned to conventional Western medicine. There are certain illnesses that traditional other practices from Ayurvedic to TCM, which they have cures. They literally not an issue for them at all. It has like 100% treatment rate for the right type of So I'm telling you now, if your child has asthma, do go to a very reputable. Don't just go to a person who. Because I just want to let everybody know too. I found out in Philippines that you can become an acupuncturist with a 6-month course, and then you become a certified acupuncturist. So they may not be able to give you the kind of correct treatment. So I know personally, Sister Regina in Quezon City, very experienced, very good acupuncturist, fully trained. In fact, she holds a school, right? So if you go there, tell her Shen sent you, right? So yeah, asthma can be treated with acupuncture, so you don't have to live with it all your life. Okay? My own cousin, who had very serious asthma, was cured through acupuncture because one of my uncles is an acupuncturist. Okay, so yeah, I hope that helps, and I hope that gives hope to whoever that viewer is, that your kid doesn't have to live with asthma.
Thank you. There are so many learnings today, starting off with the BRCA and now the acupuncture. Thank you, sir. Thank you, Doc. Right, another interesting question: will my dialysis lower the effect of or the effectivity of the vaccine?
Your what again?
Will my dialysis?
Dialysis.
Yeah.
Okay. No, it won't blunt the effect of the vaccine.
Wow, that's interesting.
If you receive a vaccine, then the effectivity of the vaccine depends on how robust your immune system is, how well it is functioning. So that's why if you are practicing lifestyle habits that make your immune system strong, then the effect or the efficacy or the degree of protectiveness that the vaccine will give you will be much stronger. Okay? For dialysis patients, it's different because dialysis, you're only cleaning the blood. So if you receive the vaccine, your immune system has already been exposed to the effect of that vaccine. So even if you clean the blood,
You won't erase the benefit.
You won't erase the benefit of the vaccine. Your immune system will still learn to recognize the things that the vaccine gave you protection for. Okay? So,
that's such an interesting question. I think this is a question that many of us never asked, but the moment it came out, we're like, oh yeah, that's a very good question for them to know too. So yeah, that's really good.
Very good question. Right. Thank you, sir. Thank you, Dr. Jansen. Another question coming from Angelina. I had my mastectomy 6 years ago. Last 2 months, my CA135 reached to 4,400. So I had my first cycle chemo. What can you advise me, Doc? Thanks and God bless.
Okay, you have to go for a consult. Okay, so I can advise you more specifically, so I can help you more specifically because I need to know your history. We have to talk about the problems that you are facing right now, right? So based on the problems that you are also the goals that you would want. I mean, what do you want to get from your cancer treatment? These things we have to talk about so I can advise you properly. But just to give you a advice right now so you can get value immediately, plant-based diet. Okay, so there you go.
And I think that this thank you, Angelina, for asking this question, because so many times we're just focused, cross the 5-year mark. I crossed the 5-year mark, I'm safe. If you take a look at our talk on recurrences, you will see an increased rate of recurrence at the 10-year mark, even higher recurrence rate at the 15 and 20-year mark. So cancer patients who have surpassed the 5-year mark, get it out of your system or your thought process that you can do whatever you want after the 5 years. No. All right. So cancer is even healthy people, as we age, we should start to be concerned about developing cancer. The rate of developing cancer is almost 50%. So half the people in the world will get cancer at least once in their life if you are born after 1960. So we are seeing that statistic actually come to pass. How do we know? Well, in Philippines, we have many big family gatherings, right? I know my director in my company, every time her family gathers, 300 people. That's a huge family party. Always they can find someone who just got diagnosed with cancer. So you can see how common it's becoming. So there are ways to manage this and to treat it. So thank you, Angelina, for highlighting to all the other cancer patients that are watching tonight and those who are fighting their first fight with cancer, that don't just stop at 5 years. All right, make sure that you adjusted yourself so that you have a fun, full life, and yet your life is naturally, automatically anti-cancer, so that you keep cancer away for the rest of your life.
Thank you, sir. Thank you, Dr. Jansen. I think this will be our last question for tonight. This is, why is there a new flu vaccine every year?
Why
is there a
new flu vaccine every year?
New flu vaccine every year.
Can I take this one?
Sure.
All right. Thank you, because I actually this is something that I actually looked into, and this is when you take a flu vaccine, they are guessing, but it's a very educated guess, and how they decide what. Because the virus mutates and there are many viruses that causes flu. So what they do is they copy the other hemisphere. All right? So they will look at the type of flu that was in Australia. and then they will project what kind of flu will come to the US. Then whatever flu that happened in the US, so for example, the Americans vaccinated the type of flu that the Australians had. So the people who will catch flu in the US despite the vaccination will tell the Australians what type of flu to inject next season. Okay, that is why the flu vaccine that you take every year is not the same, because they are vaccinating against different types of flu virus. So they are projecting based on what's happening. Okay, the reason why looking at Australia is very simple. When Australia is having winter, US is having summer. And when US is having summer, Australia is having winter, all right? So they see which virus appeared to the other side of the world, and then they know the next season we're going to mix our flu viruses to match that. There are so many possible viruses that can give you flu. They can't inject you with like so many different vaccines. So they make an educated, statistically calculated, tailored for what is likely to come. Okay, so I hope that gives you a very clear answer why your flu vaccine is not the same. So don't just take last year's flu vaccine, okay? Don't go to a doctor who wants to clear the stock of the extra vaccine that he bought. Okay, so there is a new vaccine for every year, okay? So don't say, I save money, I take last year's batch. No. There are many expert virologists who take a look at what's happening in the rest of the world, and they project what will be the incoming flu for the next season, and they adjust accordingly.
But I think just to assure everyone, the expiration date of a flu vaccine, of the influenza vaccine, is 1 year.
Oh, okay, so yeah, so there shouldn't be leftover stock. There shouldn't be leftover stock. So that's a very unscrupulous doctor if you ever got last year's vaccination.
Yeah, so
okay.
Rest assured, you'll get a fresh batch every time.
All right. So I think that, I learned something. I didn't know about that 1 year validity, but I knew because I watched a research program on vaccination and how vaccines are developed, and why the flu vaccine, how they are developed, and so that's why I can answer. Oh, Sheila, she's stuck in a very cute look. All right, I think that was the last question, and so as to not hold up anybody's time, Doc Jansen, any last words?
So the topic that we discussed tonight is vaccination in cancer patients. So we know that a lot of complications that cancer patients face, especially when they are undergoing chemotherapy and radiation therapy, are infections, okay? And infections are very easy to prevent. So you just have to get vaccinated. With a very simple, with a very cheap vaccine, you will be able to protect yourself from these different complications that may cost you a lot, in terms of financially, and even cost you your life. Okay, so that's the message for tonight. Sean.
So I will do what Sheila normally says. So okay, we have upcoming webinars. So next week's topic, let's take a look at next week's topic. Next week's topic is, very good one. Doc Jansen promised this, and we did the taping this afternoon. So how to eat correctly for the holiday season. Now, this is not about telling you not to eat anything. What we are going to do this time round, this year, is a bit different. We give you the tools for you to go and test what you want to eat to see whether they are good for you or bad for you. So no, we're not going to say don't eat ham, don't eat anything. No, this time round, Dr. Jansen gives you 3 tools for you to make your own judgment call on whether this food you want to take or not. Okay, so that's for next week. And again, we want to thank everybody for joining us tonight. I really appreciate the questions because I got to learn a lot tonight as well. So from Simply Nature and Simply Healed Medical Group, we are always with you from start to healing. See you next week.